Um, this past month, we had 2 meetings about that. We met with her and discuss what she would need from us and talk about her progress with Kathy at the Family Conservancy. Oh, here's our Start at Zero guest. I might pause then and let them go because I told them I would let the Start at Zero person go first so that if they had to jump off, then they didn't have to sit through the rest of our meeting. Hi, Arlene.
Good morning. Sorry, I had some technical problems. I apologize.
That's okay.
Oh, goodness. How are you today?
Very good.
Good. I'm trying to. I apologize. I have some technical problems with my computer today.
Perfectly all
So-
right.
Oh, goodness, what's going on here?
I guess I can give you guys a reminder. I was looking at their application. It looked like we funded to support their parent cafes and group connection programs.
Yes.
And it focused on integrating the value of nature-based play and physical activity into their programming.
Okay, found it. I apologize. My computer, I apologize for really, my computer doesn't want to cooperate with me today. So yes. I'm trying to have it. Yes, I apologize again. Hi, my name is Arlie Martinez. I'm the director of programs with Start at Zero. And yes, we like Natalie was saying, we have some funding for, yes, early childhood and the parent cafe and the group connections. So I'm going to talk a little about our program, Start Zero. This is our staff, and you see our staff represent the community that we serve. And we have a great staff that works with us. And we have all our parent educators. And we have a wellness coordinator that she's been helping us at Group Connections doing yoga. So it's movement that we've been adding to our Group Connections as well. This is our board. I also represent our community that we serve. And Start Zero was funded in 2018. We became affiliates. And this means that we have a evidence-based model by parents and teachers. And we have full consultation from the PAT National Center. And every year we have APR, that is the Affiliate Performance Report, that help us have continued quality improvement in our program. Right now, we're going through the quality endorsement and improvement process to earn a Blue Ribbon endorsement. We already finish all the data with them, and we need to do 81 of the improvement, and we end up having 80 that we met. We have a high quality management system that we use. It's called Penelope. We are supposed to be called parents educators, but a year ago we went to a different trainings, and now we are called family supported workers, and we support the families with the services. So we do, all our parent educators are also community health workers. Any questions? I've been talking here. And these are the things that we work with our parent educators, and these are the preparation that they all have. Our programs are the home visiting program that we have. We do developmental screenings twice a year for the families, and we have the group connection. And those are the things that we serve and we provide to our families completely free. Everything that we offer is completely free for our families. Star Zero is doing this. It's a proposed project to do the holistic early childhood development and programming with focus in integrating value of nature-based play and physical activity. And in the program that we say the Parent Cafe and Group Connections, we've been increasing our activities to going outside and enjoy more outside. We want to bring our families back outdoors. I've been working with this with the families. We've been engaging in our healthcare and public health sectors. We've been adding this to our programs, and these are our families. We like to go with them on outings. We have a great time with them always. And this is the strategies that we're talking about. They have the early childhood, strategy 7, and priorities 1 to 3. We decided to have adding more activities in our home visiting program, in collaborate with sectors that have family connected to resources and physical activity, and include physical activity and assisting family engagement, like the Families Cafe, Families Event, Family Educations. What we've been doing is our home visiting. We encourage our parent educators to do home visitings outdoors or in the park if the weather allows, because Kansas City can be very difficult with the weather. Like today, it's raining, and we can have a beautiful day. So when we have great days, we've been doing this with the families. Our parent educators are going outside, doing the visits outdoors, having a lot of activities with them. We're going to the parks when we do visits. We'll be doing all kind of different activities with the families to increase them going out and enjoy more the outdoors. Strategy 11, we talk about park and recreations. We have the building cross-sector to promote physical activity in public parks, and we're doing our group. We have the group connections twice a week. We'll be going to public parks. Last Friday, we went to the zoo, and our families enjoyed the zoo. We went walking, looking at the animals. We went and participated in all the activities that the zoo have that we can be outdoors. The other thing we talk about reimagine parks as a third choice of amenity. We encourage our families to go more out and go to the parks and enjoy the parks in the city. And that's what we do in the field trips. We do group connections Wednesdays on the office and Fridays outdoors. So we're taking our families to different places like parks, zoo, Wonderscope, different places in the area, so they can go outdoors and learn how much Kansas City has to offer for them, besides being at the home with the home visit. We also engage with local environment conservative organizations, and we're having trainings that they come to talk to us about outdoors in Kansas City, places that we can go, so that our educators know other places that they can engage. This is an example of group connections. This is one of our calendars that we do. This is the one for Wednesdays. We have one for Wednesdays, one for Fridays. Fridays are field trips. So just an example of what we do and the different activities we have for them. And we've been incorporating movement in every group connection. And like I said, we have our wellness coordinator that she does yoga when she is able to do. We are going to have at the end of the year celebration that will be in July 7th. It's going to be in the park. And there's another opportunity that we do for families to get them out, enjoy the parks, and be active. After this, we're going to have also our sidewalk. We do also sidewalk celebration too. We wanted people out so they can walk, enjoy, and have different activities outdoor. Like I said, we have play connections, group connections, play groups, we call it, and the Parent Cafe are the two activities. Parent Cafe is mostly for the parents, but we also do different movement activities with them there at the Parent Cafe. We did a yoga one, and we add movement to all of our activities we have. Any questions, I'm sorry, that you guys have, or you want to ask me? We have a resource network that we have, developmental screenings, healthcare access, and utilization support, extensive guided referrals and connections, long-term vicinity for children prenatal to 5 age. We have a great resource connection that we have for our families to help them in everything that they need. Like I said, we have a lot of encouragement for them to continue going outdoors and enjoy the outdoors with their families, because we know that being outdoors prevent a lot of ACEs in our families. We're always looking for volunteers for our group connect, for our company. We always want people to volunteer with us. Cleaning, organizing, helping for the events. This picture here, what we have is a hike for visits that we do too. And it's amazing. We go for a hiking with all the families, and it's a social event that we do, and also a fundraising event that is part of that. And like I said, we have the sidewalk celebration that we do every year, and it's a time to gather and celebrate our parents and caregivers. And we have so much fun. We have a lot of outdoors activity that day. Parents walk from one side to the other of the sidewalk with their children in a safely manner. And it's a holistic activity that we have. This is our Camp Wood weekend. We go camping with our families, and it's a great things to do, especially for our BIPOC families. Sometimes they haven't been in camping at all. And it's a great opportunity for them to go out, enjoy the outdoors, go fishing. This group, and especially, I think the majority of them was the first time ever they've been on camping. And they really enjoyed the outdoors. And after this, they committed to continue doing it. We do this annually on a weekend, and we're planning to do this year as well. We have also a brunch that we do for our parents that honor their involvement in the program and their commitment to their children and the community. It's another fundraiser that we do every year, and it's a very beautiful fundraiser. Our parents are very proud of what they do with the families. We see the growth in them, and we want to continue empowering them. We really appreciate people and you guys investing in our community, in the children and the families in Kansas City, because every time we have companies like you guys that invest in us, it helps us grow more and help more families and increase and make our programs better. Any questions that you have, guys, about our program or services?
Arlene, is it all income verification based? Like, is it for low income families mainly, or can any family join the program?
Yeah, any family can join the program. We try to also work with the BIPOC and high needs families. We do work with both of them, but any family can bring. However, mostly of our families, high needs families, usually for them, it's kind of difficult to enjoy the outdoors. Sometimes they're a little concerned about it. So we try to bring that back to them, but it's for any family.
Okay, thank you. I've been in social services for a long time, and I can't say that I had heard of Start at Zero. So it is great to learn about you guys.
We are, like I said, we use the parents as teacher curriculum for the families. We do home visits, we do screenings, and also free for the whole families. Our screenings and good connections, families doesn't have to be part of our program. It's for the whole community to come and be there.
Great, thank you.
And you serve the Metro Kansas City area, right, Arlene, on both sides of the state?
Yes, KCPS, a school district, yes. We have families, Jackson County, we have a couple of families on Independence that we serve as well, but mostly the Kansas City, yes.
So that's just on the Missouri side then, Arlene? I think that was what we were.
Okay. Yes, for now, yes, for now, yes.
Okay.
However,
Thanks, Lauren. That's what I was, yeah.
However, if we have families that come from Kansas to our group connections and do the screenings, and we're okay with that, but mostly we serve the Missouri area. But if somebody from Kansas kind of want to come to our group connections, we're okay with that.
So Arlene, as far as your encouraging outdoor activities, how or have you guys had the opportunity to encourage it in all types of weather and not just when it's beautiful outside? I mean, selling somebody on going outside when it's beautiful is a lot easier than when it's not. So do you
Yeah.
have experience with that, or how do you guys kind of do that?
Sometimes group connections, when the weather is not good, is with our families kind of like, oh, we don't want to go out. So we try to, what we do is, we still, we encourage them to come. If the weather is not allowed, we try to be in the office and do activities that are movement inside the office. Or we bring stuff from outdoors, indoors, if necessary, like leaves, rocks, things like that we can experiment inside the office. Because when the weather is really rough, it's hard to go outside. So we try to bring the outdoors indoors as much as we can. And if the weather is, we try to go outside still. We tell the families, be ready, get ready for, we're going to be outside. It's going to be a little cold. Let's go outside. We try as much as we can. But Kansas City is very moody. Our weather is moody.
To say the least, yes.
Tomorrow we were hoping to go to the, like I said, we do Fridays, field trips. We were supposed to go tomorrow to the park. We already know it's going to be raining. We're going to do it next Wednesday. Tomorrow we already have a lot of plans for having an indoor, outdoor activities inside the office. And we brought we have tunnels, we have things that the children can climb and do inside the office. We have a little playground sometimes.
I thought you were going to give me the key to unlock everybody going outside and using all types of weather to their advantage, but you haven't found it yet either.
No, it's just that we try, but also, some of our babies, our families are little tiny babies. We have little tiny babies, and we have to take that in consideration when we do group connections. We have 8 months old, 7 more, 7. I mean, we have all kinds from 0 to 5. And when we have the little tiny ones, it's hard to get them outside.
Well, I can also see you have to, weigh your options. Do you want them to come and be engaged and get physical activity? Or do you want them to say, this is volunteer, I'm not going because it's raining? So I appreciate that. Thanks.
I got a question. I remember when you guys were presenting this application, Demisha mentioned that you'd had some problems with like safety in the parks. Like sometimes the sidewalks were deteriorating, or there was even like trash and needles sometimes. Did that improve at all, or are you seeing the same problems?
It's Kansas City, downtown.
Yeah.
You have some situations, right? We've been trying to, what we do is, we go to a park, we go beforehand, and we clean the park. I make sure the park is safe and clean for the families. So that's what we're doing. We lately, we haven't had a lot of, we try to pick and choose the parks. I'm not gonna lie, some of them, we have one that it was very bad. We're not going back to that one again. So we're trying to get parks that is near to where the families live and they're kind of safe. But like I said, we clean before going to the parks and make sure that everything is safe, clean, and our children can enjoy. But it can be tricky.
Yeah. I know after we had those initial meetings where she was explaining the project, we had a couple meetings with the Parks and Rec group, and like Jen from KCMO Parks and Rec. Did any further partnership, was it able to get started with them, or did that just kind of fall flat?
I don't know. We haven't had to talk with them. I need to ask Dr. Wade. We continue. I know we were having talks, but I mean, sometimes, I don't know, we're going also, we're going through a transition. Dr. Wade, she transitioned to Oregon to live. So there's some stuff, yes. So we're in the search of a new executive director right now. So there's some talks that we have to put on hold, sadly, till we have the new executive director.
Yeah.
It's
I
being
think
one of,
that- I mean,
it's kind of
like-
tricky, some talks with us. That's why we try to continue with the programs we have. We've been having invitations. I say, okay, give us till fall. We will have everything back again. A lot of the talks that we're doing, we're going to have some of them back on fall, but we haven't talked to them. I think
Yeah, I think I remember it was mostly like they talked about maybe starting a swimming program. I guess one of the pools you guys have previously used was closed for a while, and
Yes.
then maybe some program like structured programming in Swope Park, but it
Yes.
sounds like we'll have to wait. But it was still
Yeah, we have to
exciting.
wait.
Yeah.
Yes, I'm hoping, hopefully we have more. I'm hoping by fall, July, we're gonna have our new executive director beginning in July. I'm hoping we will have a lot of more conversations with more people when we have all those in place. I'm excited
Yeah, well,
to new things are coming.
when you get a new director, feel free to reach back out to us and we can connect you again with some of our parks partners.
Yes, yes, we will keep you posted. Yes, we are still working on that process. But I'm
Yeah, of
hoping
course.
that we'll have somebody hopefully by the end of May. We're gonna make the announcement.
So Arlene, was there anything in this project so far that you've encountered that you had planned on doing and that just fell flat and didn't work?
We like I said, we want to go more outside, and that was a little more that it was a little tricky because we began our group connections on February, and we had that amazing storm on February. Yay! So that kind of delayed us some stuff. So we decided, so that's why, and we're gonna run them till May now next week. And that was a little tricky at the beginning, how to make it work when we have all this very cold weather, right? So we have to begin reimagine and do some stuff indoors that we didn't want to do. So that was a little of, that was not in the plans that we had, the weather getting our plans. So, but we tried to implement, that we did is, we have the wellness coordinator, so she began going to our group connections and do some yoga with the families and have all this wellness of mind and body that we can work with them. And the group connection, we begin adding a lot of movement and more movement, more and more indoors. Like I said, we have a playground in our office right now for the families to do.
When you're going to different locations, was transportation an issue sometimes, or how do you handle that?
Yes, we been doing Uber for some of our families, if necessary.
Mm.
Or we can, one of we have we can transport, we can transport families, us too. So the girls, if they can transport at least, one family to the activities that is necessary. But do Uber or we provide transportation. Yeah, but transportation is a big issue sometimes.
Yeah.
That's why we decided to begin moving around city a lot more to the places that we know our families are more close, so it's easier for them to go there. Our field trips have been a great, our families love them, we love them. It's been so exciting, and they love going to different places. I have families that never been, for example, Wonderscope. They say, what is that? Let's go to Wonderscope. And they see they have the outdoor place. So we've been going to the outdoor, indoor, doing the activities with them and doing all the movement activities. I'm sorry. I think my presentation went away. I apologize. My internet is being, my things are working bad here.
I still see it. Does everyone else?
Okay, it went away on my screen. I apologize.
Does anyone else have any more questions for Arlene? Okay. I have one that's not related to your presentation, but our sports sector is looking into doing a more organized sports equipment donation throughout the city. Does
Awesome.
Start at Zero have any need for any like sports equipment, like balls, or I don't know what equipment you would need with that age group? If I would put you guys on the list for,
I don't know, Dr. Wade told you we open in a play cafe. Hopefully June or July. And I need to, I think we're gonna need equipment for that one, yes. I mean, door,
okay,
yes, yes.
well, I can
Yes, I would
follow up
say-
to see what you guys need.
Yes, we're gonna be opening the play cafe. We were supposed to open on now on spring, but you know, the city permits, it's taking a little longer, the construction. But hopefully by July, we're gonna have a play cafe open. And we're gonna have a lot of activities there. We're talking about doing classes, yoga classes, fitness classes, everything, because it's gonna be a little playground indoors there for the families. They're gonna have a playground, they have a cafe and a playground, so parents can go have a coffee, have a sandwich or something, and then be with the kids while they play and also play with the children in the area.
That's exciting.
We're very excited about it.
Where
So are
about
you
is that gonna be
actually-
located? Sorry.
No,
No,
you're
it's
good.
okay.
That's what I was
Fine.
Where is it? Where is it?
We're gonna invite you over, but definitely when we open. 5546 Truth Avenue.
Okay, well, thank you so much. You had a really beautiful presentation and we loved hearing those updates. It sounds like you guys
I
have been really
apologize with
successful.
I apologize with the I've been having some issues with my computer, so I apologize. I was a little like, okay. But thank you so
That's
much.
okay. And if you wouldn't mind sending me that flyer for your event in July, then I can promote it in our newsletter.
Yeah, we're gonna have that one in July, and we're gonna have in June 7, we're gonna have the end of the year celebration, and in July we're gonna have the sidewalk. Yes. I'm gonna send it out to you so you guys can have it, and yes, it's gonna be so much fun. And we have free ice cream too, Oshali, for the sidewalk celebration.
Okay, great. Thank you.
Thank you so much.
Yeah, you're welcome to hang around for the rest of our meeting to hear about our Dr. Craft event, or if you need to go, that's also fine.
Okay. Thank you so much for having me. And I really appreciate your time to listen to our presentation and our program. And we look forward to continue working with you guys. And thank you so much for everything that you're doing for our community and our families and everything that will continue like this beautiful partnership. We really appreciate it. Thank you.
Thank you.
Have a nice day. Bye.
Okay. Open my agenda again. Okay, Kelly, I think Chris told me that she kind of filled you in about our Dr. Craft event, but it's gonna be at the Johnson County Arts Heritage Center on Saturday, September 7th. And we, the setup team, can get in at 8, and then we'll open the doors for everyone to come into the registration table at 9 and try to get started as soon as possible. They initially told us they wanted us to be out of the building by 5, like have everything packed up and everyone gone. But I think we're a little nervous about that happening if we end at 4:30. So I have emailed them to update our contract to add an hour. And I think it'll add like $120 or something to do that. But I think that might be worth it. So in case, especially if our break goes long or lunch or something, that gives us a little extra cushion to make sure we get the full 6 hours that we need.
Will you just refresh me on that event? Chris she's told me quite a bit, but and then just overall, like what do you need from like community partners, and is it geared towards anybody in the community, childcare providers, that kind of thing?
I think the goal is like early child care professionals so that they can take the information they learned and go back into their centers or home-based programs or anyone working with early child care age kids and incorporate more physical activity programming and activities.
Okay, no, that's great. And sometimes like with the nutrition program, sometimes we can even get away with counting some of the wellness things for the nutrition training. It has to go through the Department of Ed to be okayed, but there's such a push for that, for the wellness part of it, not just nutrition. So it's really was neat to hear about this event. And let us know what we can do too. We work with about 300 providers on the food program. So we're in their homes a lot and able to spread information, and always happy to do that. And I didn't know if your organization has any ideas on, I've been talking to Family Conservancy a little bit about maybe us doing some collaboration for our nutrition training, because we all have to go through getting trainings approved for our providers through the Department of Ed. So we're kind of trying to like not duplicate each other's work and help each other. And one of the sponsors in Lawrence, I just did a training for them, and then they came and did a training for us. And so me and Kay and Katrina and Mary at Family Conservancy are going to just kind of talk about other things we can do. But if there's like a wellness kind of nutrition based anything, like anything we can promote, we want to do that. But also we're kind of looking to maybe how can we start with more wellness, and maybe having some activities like, a fun run or just something, just kind of beginning ideas how we can do more on the wellness part of it versus just like the actual nutrition programs and guidelines that the providers have to follow. So just definitely interested in getting involved.
Does that push for more wellness programs like your organization, or what providers are asking for, or the state? Or
no, sadly, I can't say really the providers are asking for that. It is with our Department of Ed people. I feel like of the providers, I feel like a lot of them are overwhelmed and have a hard time fitting their own wellness in. So we've tried to push towards their own wellness with a lot of our some of our nutrition trainings and just different programs or burnout. Chris and I are involved in the Raising JoCo Coalition. We just had one and kind of talking about geared towards that and burnout. But I feel like with my providers, they don't have time for their own wellness, it seems like. And some of them do, you hear about that on home visits and all of that. But also what could we do to kind of get their families, things they could do together, or their families and the children, their daycare or childcare families more involved together to do something. So that's why we were kind of thinking, well, maybe, there's some kind of event or a fun run or, just something to do. But we are definitely trying to think more about that, because it does, of course, we all know that's a big problem.
making me think about Corporate Challenge. That group is trying to add more like family programming events.
Oh, neat.
Incorporate more of the whole family.
Kelly, what
so-
would you need? Because we are, Family Conservancy is working on, of course, getting a bi-state approval through KDHE and whatever it is on the Missouri side. But what would you need if, food program participants came? I mean, they could use the KDHE hours for their KDHE hours, but then what would they need to, on their certificate? Would there need to be additional information to say this is approved for your CACFP hours? Or I'm sure Katrina is probably honed in on that since she's working with Family Conservancy.
Yes. And so like we have to put on our, like the core competencies on our certificates, and everything we do does have to be approved through the Department of Education. But usually, and Lori can tell me if it's the same in Wyandotte County, Johnson and some of our other counties, if the food program got it approved, then usually the health departments are real good about accepting that for their providers for clock hours. And Lori might be able to better speak to that for Wyandotte County, but we do get it approved through the Department of Education, and they are trying to look more, not just, whole grains, like the actual nutrition education part of it, but they are trying, because it is like, the advisory committee we're on, it's child nutrition and wellness. And there's a lot of things that come before the actual food that you're putting in your mouth, as far as, you know, your whole grains and your fruits and veggies. There's a lot of other components to wellness. And the Department of Ed is trying to kind of get more around that, where they will approve, you know, when you're teaching the kids yoga or, you know, whatever, those things that would also be able to be approved for their annual 2 hours of CACFP nutrition training. So there's just kind of talk around that right now. And so they said it's just kind of an individualized basis. If we have something or develop something or work on something with somebody else, just turning it in and getting it submitted, you know, for approval. But I am glad, because I do feel like the nutrition programs are looking more at more what is involved in the wellness, not just you know, the actual CACFP guidelines of what they serve. So they're kind of starting, I think, to really feel like there is other components to that. And that's good for us to hear. So when we do some of our training planning and kind of thinking about working with partners, we're starting to think about that. How it's not just us going out now and teaching you on whole grains and how to incorporate more you know, meat alternatives into your menus, that kind of thing. Like we're excited that they're maybe starting to support us doing other things that come before, you know, or along with the actual food. So it was neat to learn about this program as well.
So do you guys think that it would be worth our partner that's supplying the information to get these approved also working with Kelly to see if we can submit it also for that approval?
Well, Kelly, I haven't been up on the CACFP, but they're only required to have 2 hours of
Yes.
food nutrition. So to me, Lori, I think that they're probably going to get that from their food sponsor, and this would just kind of be an add-on bonus for their KDHE hours type of thing. So I'm not sure if it's worth. And Kelly, do you think it's worth going that other route?
Well, so what we can always do with any training is then submit it. So, and of course, anything we do, like I said, the health departments are real good about accepting for part of their KDHE clock hours, their nutrition stuff, and, you know, those 2 hours counting towards that. Like we're getting ready to do with the Institute of Child Nutrition, we're going to do norovirus and childcare. And of course, I'm sure that, that would be accepted. I mean, I know most of the counties are that way, but there's a lot of different things like that, different things that providers, I think, want to use to count for their CACFP nutrition training, but that does have to come from the sponsor. So like me, or Kay and Katrina at Family Conservancy, or the other ones we work with, like Lisa up in Lawrence, we would have to just submit something anytime there's any kind of training that is around wellness that we would want our providers to be able to use for nutrition training. So it would just be a matter of us getting information and submitting it to our consultants at the Department of Ed. So that's not ever a big deal. But we still like to be involved in trainings and doing things with different partners, even if they necessarily can't use it for their nutrition training. We still like to support that stuff too.
Well, if you want to go that route, maybe, since you already, have conversations with Katrina, maybe just keep up to date with that and see if it's something you want to submit from that end. Because she may be submitting for Family Conservancy.
Right. Yep. I'm supposed to have lunch again with them soon. So I will definitely talk to them about that.
Yeah.
You guys said the event was September 7th, right?
Yes.
Okay.
I know Kathy has all the paperwork and agenda and at the Family Conservancy, since she did the submission.
Kathy McCall, Kelly.
Yeah.
And Natalie, we talked about on the last planning call about getting a save the date information out. Is that something Kathy's working on, or do we need to kind of? I don't know how soon. I always feel like the sooner you get it out, the better. Not to say that someone's going to read it or they're going to transfer that date to their calendar, but we've at least given it a good shot, and we can do some periodic ones about that. So I'm not sure where we are
It
making
should
that
be
happen.
ready next week.
And I would love, I sent you guys my, my email, but if you have like a save the date flyer too, I'd love to be able to send that out and like our bulk email system to our providers as well.
Great.
And Natalie, remind me, what's our capacity for that day?
200.
200, okay.
Oh, wow. And how many KDHE hours will they get for that day?
6.
Oh, wow. That's awesome. Okay. And that's really helpful too, because I know like me and Katrina were talking about this once. It's nice when everybody's starting to plan stuff, you know, to have all the other events. So you're not duplicating or, you know, doubling up on days where providers don't have every opportunity to go to every event they want. So I'm happy to learn about that, but I definitely would love to spread the word too, because that's a great opportunity for them to get 6 hours. And is there a cost to the provider? No.
We just for food coverage, it should be, I think, under $25.
Okay, yeah, that's great. Yeah, I mean, that's darn cheap for 6 hours of KDHE hours, you know?
Yeah. I was actually going to share with this group a little budget I had made, just as we're trying to work this out. So since our last meeting, I had met with Janelle at the Family Conservancy, and it just seems like it's going to be easier to have them like be the financial sponsor, because the accounting department at Children's Mercy, it'll be hard to make multiple purchase orders, and they just don't do deposits. There would be no way for us to put the money back in the account after we get the deposit back from the rental space. So last week, our sector application was reviewed at the core work group meeting. So we asked for $5,000 for this project, and it will be awarded to the Family Conservancy, and then they will handle the contract for the rental space and pay Dr. Kraft and pay for the food out of that money, as well as handle the registration for the event. So do I need to zoom in? Can everyone see? This first one is just Dr. Kraft's travel expenses, the room rental, but we'd be getting 500 of that back. Equipment that Dr. Kraft is requested for the presentation. And then this would be the make and take it kits. If we bought it for 180 people, and this is based off the estimate that she gave us, like purchasing those materials at like the dollar store or Target. There might be some variability based on what we can find to purchase those. The 450 is for the Family Conservancy staff time to handle the registration. This is also one that's variable. We haven't figured out food yet, but I did it just based on if we had 150 participants at $20, then that would be that much money. And then the registration fee, I believe they said it was going to be like $2 a person per register. So that's where that 300 comes. So I subtracted the 5,000 from our funds, and this is how much we would still need to cover. So that's kind of like how we would, if we had 150 people, we need to charge that much. And if we had 100 people, we need to charge that much. So this is clearly just like a loose estimate, because we don't know how many people are going to register and how much supplies we're going to need to buy. But just to give everyone an idea.
Well, and like Kelly said, I think if we kept the registration at 25, no matter how many people attended, that's still a great cost for getting 6 hours of in-service. And even if
Definitely.
needing to bump up to $30, just so we're making sure we're covering the food costs and we're not having to scrimp on that, or, you know, I don't know
Yeah.
if you can really estimate, you know, the attendance numbers, because you're going to need to put that number out, that registration cost out there.
And I know in the past, like we've done our events, and sometimes we can offer them totally free. And then, but if we, like you said, if we have non-food program people, like we can never charge for food program stuff. But if we have other speakers that are traveling and doing things, you know, same thing, you have to charge them something, and they're used to that. I mean,
Yeah.
sometimes we'll charge $39, $49, and that's for 6 hours, and that's not been bulked at. So I don't think you'll have any trouble with that at all.
Especially if you offer food and they're not having to go
Exactly.
anywhere. I mean, if
Yeah.
you're doing, if we're having anything in the morning or afternoon and then a lunch, that right there is, they'll see that that's covering
Absolutely.
just the food costs, whereas the trainer, and you're bringing in a national speaker, so
Mhm.
they'll be
Yeah,
accepting
and
of
really
that.
we have an extra $500 cushion with this because we should be getting that $500 deposit back. So I think 25 should be safe to charge everyone.
And then do those costs, Natalie, per person, then take out the food costs, like, or is that something that wasn't accounted for? So if we only have 100 people and we're estimating 150 at
Yeah, that
$3,000,
wouldn't,
okay,
yeah, we wouldn't have as
Right,
much food cost
okay.
or materials cost if we don't have that many people register. So I think.
So Natalie, at this point, what kind of needs or help would you need from like your community partners?
Well, right now, I think mostly marketing and then having people say that they'll help day of.
Okay.
Or I guess we'll need to assign jobs and I think especially during the make it and take it portion, it sounds like Chris thinks it will be good to have people that know what we're doing ahead of time and be able to like walk around the room and help people make those kits and activities. I don't know if we want to assign a couple tables per person type of thing.
Okay.
Maybe assembling those kits ahead of time too. People to help with registration, set up food. We probably need to start making a list of all the roles we'll have that day and who's going to cover them. We haven't got to that part yet.
Kelly, we also do have planning meetings for this specific activity. So I'm sure if you'd like to be added to that list, Natalie would be more than happy to get you sent that information.
Sure. Me and my girls all have done, we put on a lot of big trainings with our groups and our providers over the years. So we all enjoy it and we like it. And of course, marketing, and I'd love to have a save the date flyer to have my home visitors take out because we're in their home every 3 months. So we could start really doing that. But also, of course, marketing is no problem either to getting the word out. So yeah, we would love to be involved and help however we can.
Sorry, next meeting. Looks like the 21st of May.
Chris, do you know when the May Raising Joco meeting is? It's not the May 21st, is it? Is it earlier than that? Do you know?
I don't get that information.
Oh,
yeah.
I'm sorry.
Yeah.
Yeah. Okay. Yep. Never mind.
It's the other
Thinking
Nicholson
something
you're thinking of that she might
It's
get.
the other Nicholson. Yeah.
Okay. And then the last thing I wanted to talk to you guys about was food. Or any of you have experience doing this? I just did a search and like found that Hy-Vee has like those, we talked about doing box lunches so to like save time and just make it easy to grab and go. Some of
Natalie, that's who we usually use for all of our big trainings. We usually use Hy-Vee. They've even done, we usually do the box lunch, but they have done like the big potato bar. They've done different things for us. But I know Grandma's is also really, they'll probably be a little more expensive, but we've had great luck with Hy-Vee. And we usually, last fall we did we do a salad bar? Sometimes we do different things, but our box lunches, I want to say, have been $10 to $12 a person with them.
Yeah, and Kelly, because she's with a CACFP, a food program, there's certain guidelines they have to have with, correct, Kelly, with what's included. So we know that they'll be on the, I mean, you can coordinate that to be on the more nutritional side, not,
Yeah. Yeah, I
five
mean,
cookies in there and,
we try, but yeah, we can get away with, doing some of that stuff more on those days, fun stuff. But
yeah.
they have always done a really great job and really been really, just really helpful when you're trying to plan. Or you can also substitute things out, like if you don't want a cookie or you don't want though, you want to provide your own water and soda. So yeah, they've been super easy to work with.
Do you have a contact? Cause I mean, I assume you work with a Johnson County location. I wonder if there's a contact you can share with Natalie that.
Oh yeah, we usually do the Lenexa or this time I think we organized out of Shawnee, but then because they had their Hy-Vee that was going to be closer to the church we were using, I think they might have had them bring it out, but I could definitely get you contact information.
Great. Do they do like a drink service? I was thinking about, we talked about doing like coffee and tea throughout the day. And I was worried about it getting cold. Like, would it need to be delivered twice during the day?
We've never had them do that because we just usually will have our own water, little urns, and then we do our own coffee. We usually we have this, like a big pot and our stuff we use for those. So we've just done our own because typically they'll just come, start setting up, in 45 minutes to an hour before we want to have lunch, and they'll come and put everything out. But I don't think we've ever used them for coffee or anything like that. We just have done our own and had our own pots, which you would be welcome to use, and the water little urns. Usually those places will have something, you can at least refill the ice and all of that. So we just have our own stuff for the coffee and tea.
Natalie, this is Michelle Carmichael with Blue Cross. We have used Hy-Vee for coffee.
Okay.
So they're definitely very good. They bring the Caribou coffee crafts. They bring the cups, everything. So the creamers, the sugars, all of that. It was very reasonable when we've had them do it in the past, but again, cost savings if you use your own. It always is a little bit cheaper if we can just do it ourselves, but from experience, they delivered it. They came and picked it up several hours later. So if you don't want to hassle with doing it, they do a good job.
Well, I might as well, when I talk to them, like get a quote and see.
Sure.
Okay, well, it sounds like I might just follow up with Hy-Vee unless someone wants me to really look into these other options. The only other thing we talked about was snacks. I was thinking about just picking up some from Costco, like in some big boxes, maybe some like trail mix or crackers or just something for people to grab and have at their table throughout the day. Maybe some whole fruit.
That's what we do, Natalie. We just get some bananas, and then like we've gotten the Skinny Pop or different things at Costco. That's exactly what we do for our big days.
Okay. Like, and when I am looking to price that, do you think I should do it like 2 or 3 snacks per person, or what's standard way to estimate price for that?
We usually have about 125 when we do our 6 or 4 hour trainings, and we just do one snack.
Okay.
We'll do one. And really honestly, just so one a person. And so that's not a very big expense at all, because you can buy the big bags of, of course, bananas are cheap, but the big bags of Skinny Pop and all that kind of stuff, or Cheez-Its or whatever, pretty cheap. So I wouldn't say you'd have too big of an expense there. And that's just what we do. Just throwing that out.
Okay. If everyone's okay with that, I think I'll just look at getting an estimate because to help the Family Conservancy the best with the budget that I can ahead of time.
I think our Hy-Vee, it's in Overland Park, right? The event venue.
Yes.
I know in Shawnee, Angie was our catering contact. So let me ask her who we can contact over there closer, and I'll email you.
Okay. Yeah, thank you, Kelly. The only other thing I had on the agenda was to remind you about the Healthy Lifestyles quarterly meeting. It's going to be on June 6th at the Kauffman Foundation. from 9 to 11 a.m. And then they wanted me to do a plug for the Move Together KC campaign too. They're still looking for video asks. So those will be featured on our Instagram and profile during the month of June. So they wanted to do them ahead of time. So they'll just have you write a story about what you like to do to be physically active and why you move. And they'll ask for a picture of you doing that activity. So if anyone is interested in submitting for that, let me know and I can connect you with Katie and the Overflow team. And our next sector meeting will be
Natalie, you had me until picture, hun.
You could do it with your family.
I'll send a picture of my cute little pickleball assistant.
Yeah, that'd be good. I have 2 dates on the agenda, so that can't be right. The 23rd of May is our next sector meeting. As the year goes on, if anyone has any suggestions for speakers on a topic, I'd appreciate you sending them to me so I can reach out and schedule some content for our meetings this year. We had a guest presenter like at the hospital last week, and she's a research in early childhood and had some nutrition and physical activity research. So I thought about maybe inviting her this summer sometime, but that's the only idea I have right now.
I say grab her. That topic sounds right up the alley with
Yeah.
being on, yeah. Early childhood
The only
physical
thing is,
activity
I think they
wellness.
might steal her for a quarterly meeting in the fall.
Ah,
But yeah, it'd be interesting to hear like what some current research projects are going on in the area, in that area.
okay, I need to hop off, another meeting calls. That's how it goes.
Yep.
Back to back. So Kelly, thanks for joining us. Good to see
Yeah,
everyone.
thanks for inviting me. Thank you.
Yeah,
Thanks, Chris.
I hope I'm still waiting for the rain down here in South Central Kansas, but I think you guys are already getting some, which I hope it comes down here. Not the storms, but I do want some rain. So, all right.
Take
see you.
care.